This is a presentation on the Postcode Lottery, Access to Healthcare, by Laura Finch and Lily Mayer Burns. Now, the original tenets of the NHS were designed to make good health a possibility for everyone in the population equally, based on need and not ability to pay, and free at the point of delivery. The realities of adhering to these ideals has been under much pressure in recent years, as technology advances and funds retreat. Among the pressures on the service are an ageing population, meaning longer need for care and often comorbidities. Advances in medicines and technology also means we are capable of treating ever more conditions. However, financial realities mean that these resources are finite. Funding and services are no longer centrally controlled in the NHS. The Postcode Lottery came about largely from the practice of GP fund holding during the 1990s, a system which enabled GPs to receive a fixed budget from which to pay for primary care, drugs, and non-urgent hospital treatment for patients. And subsequently, since the Health and Social Care Act 2012, budgeting and commissioning of services is managed at a local level by clinical commissioning groups, known as CCGs. Now, they decide how much of their allowed budget is spent on certain services based on need and available funds. So the reality of this situation means that there are differences in the access to NHS treatments throughout the country, and there are concerns that where you live can define the quality and availability of NHS services you can expect. For example, the types of treatment available can vary. CCGs must prioritise services in the budget, and so must meet demand with supply. If there is not a great deal of need in the area, then less will be allocated, or the service may not be offered at all. There may be variances in the number of visits or rounds of treatment, for example, in one area to another. Another way of managing and reducing spending on certain services is to apply qualifying criteria to patients trying to access the care. This rationing may include age, BMI, smoking, or drinking, and justified by the likelihood of compliance or successful outcomes. Waiting times differ, and this can have a dramatic influence on final outcome and prognosis for patients. Follow-up services, health and social care and community services are also much more available across different areas. This can have an effect on recovery time and likelihood of recurrent illness. There are certain conditions that have been seen to have very varied outcomes across the country. These include cancer treatments, fertility treatments, hernia repairs, hip and knee replacements, cataracts, and varicose vein surgeries. This is largely due to varying waiting times, the demand for expensive medication, and the lack of available screening programs available in certain areas, meaning that early diagnosis is not made as quickly as it could be. So the issue of the Postcode Lottery concerns have been talked about much in recent news. One service that illustrates the discrepancies in provisions vividly is fertility services. There have been many headlines. The NICE guidelines recommend that 3 cycles should be offered to qualifying women under 40. However, in reality, only 12% of CCGs actually follow these guidelines, some opting to offer their own version of what a cycle is or how old you must be to qualify. So, as you can see, the most treatments with the most lenient criteria and the largest amount of available cycles are all here in Greater Manchester area. They define one cycle as being one fresh transfer and all variable frozen transfers. The qualifying age ranges are the same, as are the other criteria. This is in pretty stark contrast in some areas of the south of England where much less treatment cycles are offered, and the definition of one cycle is also very different. The reality is, even though the service exists here, there is a far smaller chance of success for pregnancy from this treatment than those in the Manchester CCG groups. Windsor, Maidenhead and Ascot go further in their rationing of the service by only offering treatment to women under 35. Recently, these CCGs displayed have decided to suspend services altogether. Now, two women in exactly the same position, Mrs A and Mrs B, both 38 years old, both have no children and have both been trying to conceive for the last 2.5 years. But they both have very drastically different options and outcomes through no other reason than where they live. Mrs A is far more likely to become pregnant than Mrs B.